going to show you here on the mat are some flexibility and strengthening exercises you can do for the hip in a laying down position, on the mat on the floor, on a bed. The only thing, if you try them on your bed, just make sure your mattress is sturdy enough. If you have a soft mattress, it can cause you to sink. What we'll start with is a gentle mobilization stretching exercise for the hip and the low back. You'll lay on your back, knees bent, feet on the mat, and what you're going to do is rock the knees side to side. Come to the left side first till you feel a stretch in the hip and the back, and then we'll go back the other way to the right. You want to do it slow and controlled, no quick or jerky movements as you're doing it. Typically, I like to see a patient do 20 to 30 times each side. Just taking your time, getting a good end range stretch at both sides. Next stretch we'll do is for the piriformis, which Dr. Lena had previously done on the foam roller. This is a muscle I like to keep flexible because it does lay right over the sciatic nerve. So if you've had sciatica or any kind of low back issues, this is one that you want to keep flexible. To stretch this, the side that you're going to stretch, you want to take that leg and cross it over the other leg like that. And then what you want to do is bring your hands and grab the outside of your knee and pull the knee up and across your body. And again, we'll hold for 30 seconds, get a good stretch, a good time in there. You should feel the stretch down in your lower hip if you're doing it correctly. All right, and then the next one we'll do targets the gluteal muscles in the back, the SI joint, and actually the lumbar spine, keeping the paraspinals, which are muscles that run up and down each side of the spine, flexible. For this, we'll start again in the position with the knees bent, and what you'll do is bring the knees up toward your chest. And then with both hands, if you want to give yourself a little overpressure, you can grab behind the knees like that. I always grab behind instead of on top because you don't want to compress your kneecap. Pull up till you feel the stretch, and again we'll hold for 30 seconds. Okay, so now we'll do a stretch for the IT band, and again this is one that Dr. Lena had demonstrated foam rolling. Again, it's a band of fascia and muscle that runs from the hip down to the knee. Very prone to tightness, especially in active people. Definitely a muscle you want to add to your stretching routine. I'm actually going to use a strap here. At home you can use a dog leash, a belt, jump rope, a long towel, anything that's sturdy and not going to give. And we'll put that around the foot that you're going to stretch. I'll give Dr. Lena the handles here. All right, and what we'll do is pulling with the hands, we'll bring the leg up, keeping the knee straight right about to a 45-degree angle. And then we're going to bring it across the body. Just till you feel the stretch on the outside. As you do it, you want to try not to let your hips rotate off the mat. You want all the motion to come from the hip joint itself. And again, we'll hold for 30 seconds. It's important too with this that you not pull the leg up too far before you pull it across. If you pull it up too far, you're stretching more of the hamstring than the ITB.
One of the other things we can do in this position is PNF stretching. So my hamstrings are very tight because I'm a cyclist. But what I can do is I can get to it as far as I can, and then I'm going to push my leg against it. So I'm going to contract the hamstring, trying to pull it down. And as I contract it, it helps us to go even further the next time. So the contraction, let it relax, and then keep going can help you with that. So it's PNF stretching. I'm pulling against it when it's locked, and it loosens up and goes a little bit further.